Alright, if you just joined us, this is the interview segment of Let's Talk Health, and today to talk to us on antenatal care and assessment is Dr. Olajumoke Ogunmola. She is a medical practitioner. Thank you for joining us on the show today.
Pleasure.
Alright, when we talk about antenatal care, what exactly do we mean?
Okay, first and foremost, I'd like to start by saying that pregnancy is a beautiful thing.
Okay.
So when we talk about antenatal care, it's a platform whereby it provides healthcare functions, health promotion, screening, diagnosis, and disease prevention during pregnancy.
Okay.
So it's a period whereby a pregnant woman is critically evaluated and taken care of.
All right. During an appointment, definitely we get to fix the appointment with the gynecologist at the hospital. So during an appointment, what exactly happens? What's the routine? She goes to the hospital, so what happens?
All right. I'll start by saying the first time she comes to the hospital to see an obstetrician is when we call it the booking time, the booking clinic.
Okay.
That's when you come. You would see you come to see a doctor. You're expected to provide your information. That's when we know your weight, your booking weight, your height, your booking BP, blood pressure. You're expected to tell us everything about you, whether you've been pregnant before, whether you've lost any pregnancy. Also, that's a time we also screen you to know your blood level. Screen you for any other diseases, maybe diabetes, maybe you have high blood pressure. We also want to know maybe you have HIV/AIDS, hepatitis. Want to screen you for syphilis. So that's the time we check all those things, and also we also give you your routine medication. Also give you follow-up visits.
All right, now because today on the program, pregnant women want to learn, definitely, and expectant mothers, and even mothers, women who are not pregnant yet but hope to get pregnant in the nearest future, they want to learn. So what's expected of a pregnant woman? Like, I'm pregnant, what is expected of me? What are those things I should do? What are those things I shouldn't do, I should stay away from?
Right. We generally advise every woman in a reproductive age to start taking what we call folic acid.
Even before she starts, having any plans of getting pregnant. Okay. So
folic acid every day.
Okay.
Yes. And also, so now that
what's that supposed to do?
Yes. All right. It's supposed to help you prepare your body for pregnancy. Okay. Yes, to prevent what we call some congenital abnormalities in your baby.
Oh, really?
Yes.
I should start taking that. Okay, well. What apart from that?
Apart from that, you're also expected to book early. When you find out you're pregnant, you book early. You come see your doctor, follow instructions. We found out that most pregnant women don't follow their doctors or midwives' instructions. They rather will listen to people outside telling them different things, but they don't know that everybody we are all different.
Yes.
We treat people, treatment or care is individualized.
So I think we really need to know that. Nigerians need to know that, because we're fond of mama, this person did this, this person's mother said she did this, and if I do this, I think we really need to know that we're different as individuals, and what works for this person wouldn't work for another person. Okay.
Yes. So you need to follow your doctor's instructions. Eat balanced diet.
Balanced diet.
Yes, eat balanced diet. No, don't be so conscious of I don't want to gain weight, I don't want to be too fat. Just eat balanced diet.
Okay.
Exercise. Don't so much live a sedentary lifestyle. Just exercise.
Okay. Now, during pregnancy, can we know, for those of us who have not been there, and for those who are there now but it's the first time, what is the normal? What's the abnormal?
Okay, there's something we call pregnancy symptoms. When you take in the first 3 months, usually we see women come down with nausea, like you're feeling like vomiting. Sometimes they vomit. They are just normal. Because your body is just trying to acclimatize to what is new. Something new is happening inside of you. So your body is trying to adjust. So You can have that. Sometimes you can have swollen feet, mild swollen feet.
At what stage does it start happening immediately, or
no,
stage?
Later stage. Usually doesn't happen immediately. So you can have, then later you start feeling that something is moving inside of you. That's the life, you know. Then any other thing, you add weight, some people look darker.
So these things are all normal. So which is the abnormal? What is that thing that you start noticing that you say, okay, this is not normal?
That's where antenatal care comes in. You need to, fine. I talked about swollen feet. Swollen feet, when it's not so much, is normal in pregnancy. But when you notice that you're having swollen feet, is not resolving, you need to check your BP, you need to check your blood pressure, you need to go to the hospital, let them check you. When you start having vaginal bleeding, it's not normal. Whether it's in early pregnancy, late, middle, or any time in pregnancy, it's not normal. You're not supposed to see blood. So when you have vaginal bleeding, when you see fluid coming out of your vagina, it's not normal. You need to see your doctor. You need to see your doctor. And these pregnancy symptoms I mentioned earlier, if it's exaggerated, you start vomiting, you can't even take anything, you're weak, you need to go to the hospital and let them get you checked. Okay,
so what happens if a woman doesn't start her antenatal process early enough? What happens to the woman? What happens to the child? All right. As early enough as she should have started.
Okay, to be sincere with you, generally in Nigeria we do not book early.
Okay. See, when you say early, what's early?
Early means early. You can book as early as first trimester, within the first month of your pregnancy. In fact, it's recommended when you get to know that you're pregnant, just come to the hospital.
Okay.
Yes, but usually our women don't come. In fact, they will delay till some of them will come 7 months.
Really?
Some of them will come. Yes. They stay at home.
Is there any implication of that?
Can they might, because some of them might come down, they might develop maybe high blood pressure, uncontrolled blood sugar, which can affect them. So if they don't book early, we might not be able to manage them. They might develop the complications. So it's important to book early. If they don't book early, like I said, they might develop those things and we might not be able to follow them up and manage them.
Okay. Now, are there special foods that a pregnant woman should stay away from, or she's meant to eat everything? Because I understand that during that period you have cravings for different kinds of foods and you want to eat almost everything. Are there any special things that she ought to stay away from?
You're licensed to eat anything, but not there's something we call pica. Okay. Those are not things that they are not food per se. They are absurd things that pregnant women might be feeling like eating. So you're not permitted to eat all those things. And also, I just want to talk about alcohol smoking in pregnancy. We do not advise that. Well, even if you've been doing that before, you're supposed to stop. Yes. Okay. Is it
what kind of how would it affect the baby if you do that? What will happen to the baby? Would there be deformity? Would it affect the health of the baby?
Yes, it can affect the health of the baby. There's something we call alcohol fetal syndrome. So it's a spectrum of symptoms that the baby might end up developing. So it can affect.
Okay. Now let's talk about varicose veins. I don't know if I pronounce it right. But I know it happens to most pregnant women. So what can be done to reduce it when it comes out and stop it from? What can exactly be done to it?
Okay, we generally advise that you do periodic leg rests.
Leg rests. Yes. Okay.
You can with leg elevation. You can elevate your limb, your leg. And it
stops it from getting worse.
Yes, it can. Yes, it can reduce it. It can stop it from getting worse. And also, you can also wear stockings.
You wear stockings? Is it just the normal?
No, tight-fitted.
Tight-fitted stockings. Okay. Well, this is another very key question that I know that some viewers who want to know about. How safe is it to have sex during pregnancy, and at what point do you stop?
All right. In healthy individual, sex is harmless.
Okay. During pregnancy, at any stage, even the late stage.
Yes, you can have sex, except for some people that the doctor will specifically tell them that, okay, you people can hang on sex, don't have sex. In patients where they have threatened abortion, or placenta previa, when the placenta is low lying. Yes, we tell the patient to just hold on sex.
And all of this can be found out during the antenatal clinic checkups. Okay. Now, in general, before I let you go, what are those things a woman can do to reduce risk of whatever complications during pregnancy?
Okay. The first thing, generally, book early. Listen to your doctors, your midwives that are checking you. They are your doctors, they are your health practitioners that are looking after you. Listen to them. Stay healthy. Eat good food. And also, do not self-medicate.
Yes, very important.
Do not self-medicate. I tell my patient, even if you have headache, you might think it's just an headache. It might be your blood pressure rising. Yes. So you just check into the hospital. Let them just do a checkup for you, and you'll be fine.
All right, thank you very much, Dr. Olajumuke Ogunmola, for coming on the program today. We hope that our expectant mothers out there have been educated, and for those of us who are hoping to get pregnant in the nearest future, have learned one or two things. Thank you very much for coming on the show today.
Welcome.
The program is still Let's Talk Health, and it continues right after now. To stay with us.